Hello, Dr. Tucker here. We're going to discuss whiplash injuries and car accidents today. Done training in crash forensics and mild brain traumatology, and we see a lot of short-term and long-term injuries post-whiplash after you've had your car smashed. So in the short term, you're looking at things like sprains and strains, right? Rapid acceleration and deceleration that can pull on tissues. You can bulge discs, you can tear ligaments, you can just strain muscles and tendons. So these are some of those acute symptoms that you feel, but then there's an overlooked risk that happens for long-term injuries that a lot of people don't fix after a car accident, and that's the shape of their neck. So we're going to discuss what a neck's supposed to look like and then what happens after a whiplash. So let's just say, right, this is the natural curve of the neck. You're supposed to have a reverse C shape. The C is supposed to go like this. Now, if you have bad posture or a mild strain, you can see the head go forward on some people, but essentially, instead of this, their neck will kind of jut forward, and they call that a loss of lordotic curve. Basically, you're losing your neck curve. However, whiplash can cause a buckle, and you can actually have your neck whip in the other direction, creating a reversal of neck curve, which now can stress the neck significantly more and accelerate arthritis years down the line, because the segment that had the buckle now has an abnormal loading point. So let's say your fourth neck bone has this buckle go the wrong way after the injury and whiplash when your head gets kind of shot around a little bit in the car. If you don't retrain that curve to come back, all that anterior weight, that forward head carriage, will load harder on the joint because you don't have that reverse C shock absorber anymore. And fast forward a few years later, that they don't even think relates to the car accident, that vertebrae might have a giant bone spur digging into a nerve, and now the patient years later is complaining of neck pain, limited range of motion, tingling in the hand, burning down the shoulder. So after any car accident, especially if it was substantial, have someone maybe image and analyze the status of your neck curve.